Have you been wondering what the IVF success rates are? Keep watching to learn more. Hi, I'm Dr. Mark Sklar, the fertility expert, and welcome to Fertility TV, your YouTube channel dedicated to empowering your fertility. I've been helping couples from all over the world get pregnant for over 17 years with my virtual consultations and online fertility programs. If you're trying to get pregnant, subscribe and hit the bell so I can help you too. And for me, empowerment comes with knowledge. So when we're talking about information in IVF, I want all of you to have all the information you can have before you make those decisions. And part of that is success rates. So first and foremost, what are the success rates for IVF and where do you find them? I'm going to give you some general numbers in just a minute, but if you are contemplating working with a specific clinic or you're contemplating working, thinking about working with between 1, 2, or 3 different clinics and you want to know what their success rates are, you can certainly ask them. Where you should first start is on the internet, and you should check out 2 websites. SART, S-A-R-T.org, or the CDC. These are places where fertility clinics report their success rates. So let me clarify a couple things about this. First and foremost, no one has to report their success rates. Clinics are not mandated to do that. This is a voluntary thing. Many clinics decide to do that, but there's also plenty of clinics that don't. So just bear that in mind. You might not find the information you're looking for on that website if your clinic hasn't reported. 2, the reporting is older than the current year that you're in. It's probably about 2 years old because they report at a year at a time. And so you've got to get to the end of the year, and then you've got to see they're also reporting not just success rate on IVF transfer, but also delivery success rate, like how many people actually deliver the baby, live births. So this takes time, right? If someone has a IVF transfer in December and they don't deliver till October or November of the next year, that takes time to report. So these success rates are about 2 years old, and that's normal. There's nothing wrong with that. In addition, success rates are also usually categorized by age and procedure. So often when you're looking at these reports, you're going to see that it's broken down to groups of age, below 35, 35 to 38, 38 to 40 or 42. I can't remember how those are broken out, and then over 42 and so on. So you're going to see that. You're all going to see broken down if someone does fresh IVF versus frozen. You're going to see that. You're going to see live births. So you got to take some time understanding what you're reading, because that's not always so straightforward. The other thing that's not typically accounted for in these success rates is a condition. Some women go into it with endometriosis and fibroids and cysts. You won't see that on those reports. So those patients are going to be more complicated. The other thing you're not going to see on success rates is if a clinic, and there's nothing wrong with this, but if a clinic doesn't work with all types of patients, if they are selective with the types of patients that they work with, you're not going to see that on those reports, because they're going to pick and choose the patients that they feel like they're going to have the most success with, and that's not going to be everybody. And so they tend to have higher success rates, and the clinics that will work with anybody who walks through the door because they just want to support all couples, they tend to have a slightly lower success rates because they naturally will take on cases that are really complex and difficult, and those typically yield lower success rates. So just bear that in mind. In general, the success rate for IVF is somewhere between 25 and 35%. With frozen embryo transfers, we are seeing those success rates increase, and clinics are kind of somewhere between 40 and 50%. But that should tell you that nothing's guaranteed and IVF is not 100% successful. So hopefully that information was useful. I'd love to ask all of you a question. Did you think that IVF was 100% successful? If so, just leave a comment below. A simple yes or no would be awesome. And if you are contemplating IVF or you've gone through it unsuccessfully and need a little bit more support, then please check out my IVF support group. You can click on the link right here in this eye or in the comment section below. I'll see you in the next video. If you found this video helpful, here are 3 things you can do. First, like my video and leave a comment letting me know how long you've been trying to get pregnant and what questions you have about your fertility. 2, subscribe to Fertility TV for the best tips on how to get pregnant now. And number 3, download the Fertility Wheel to find out what's not letting you get pregnant. I want your first or your next IVF cycle to be successful. And research shows that women who are in support groups get better results during their IVF cycles. So check out my IVF support group and coaching program.